posterior compartment of the forearm. Forearm has got anterior compartment and it has got posterior compartment. In the posterior compartment, we can find first is the skin. We will get when we will remove the skin, we will get the same superficial fascia and some cutaneous structures. And how we will do the dissection? What is the procedure? In upper part, we have to give a horizontal incision in between medial and lateral condyles. In the lower level, connecting the styloid process of radius and the ulna. That means at the level of wrist and at the level of elbow. So two horizontal incision we have to give and one vertical incision connecting the midpoints of the horizontal incisions. And now we will cut the skin. You will remove the skin along with the superficial fascia. In the superficial fascia on the lateral side, we will find one vein which is continued from the dorsum. In the dorsum there is a dorsal venous arch. The lateral part of the arch is continued as cephalic vein. So we will discover the cephalic vein. On the medial side, we know the dorsal venous arch on the medial side is continued as basilic vein. We can discover basilic vein on the medial side. And some cutaneous nerves. On the lateral side, we know the nerve which is the continuation of the lateral cord of the brachial plexus, that is musculocutaneous nerve, which supplies biceps, coracobrachialis, brachialis, and continued on the lateral side, and it pierces at the just above the elbow. It pierces the deep fascia and becomes lateral cutaneous nerve. So we can find the lateral cutaneous nerve. Similarly, on the medial side, we will get from the medial cord we got the medial cutaneous nerve of arm, medial cutaneous nerve of the forearm, ulnar nerve, so and so. That means medial cutaneous nerve of the forearm, which is coming from the medial cord, it will supply the medial aspect of the forearm. Near the elbow, it divides into anterior division and posterior division. Posterior division is for the posterior compartment of the forearm. Anterior division is continued in front, that is in the anterior compartment of the forearm. So here we will get on the medial side, the nerve is medial cutaneous nerve of forearm. Just above the elbow, just above the wrist, we will encounter another two nerves, cutaneous nerve. On the radial side, the superficial branch of the radial nerve we can find the superficial branch of the radial nerve on this lateral side, and it is visible 7 centimeters above the styloid process of the radius, and it supplies dorsum. It passes below. There is one retinaculum, which is nothing but the condensation of the deep fascia or band, which may be called as wrist band. In front, flexure retinaculum, and behind, the extensor retinaculum. It acts as a wrist band to keep the tendons in position, both in the flexor side and also in the extensor side. So it will be in relation to the extensor retinaculum, then it will enter into the dorsum, and more or less it supplies the lateral 3.5 part of the dorsum, though the terminal parts are also supplied by the ulnar nerve. And on the medial side, the dorsal cutaneous branch of the ulnar nerve we will get, and which will supply the medial 1/3 of the dorsum and also the fingers. Tip of the fingers on the lateral side, they are more or less supplied by the ulnar nerves. Okay, but there is there is a detailed discussion there. It needs a detailed discussion, but just for your convenience, just remember the lateral 3.5 is supplied by the radial, and the medial is supplied by the dorsal division of the ulnar nerve. Ulnar nerve is, we have seen in the palm, we have seen in the forearm. Okay. So these are cutaneous nerves, skin, superficial fascia, and all these nerves. And we can get also an accessory cephalic vein and others. So when we are removing the skin and the superficial fascia, we will get the deep fascia. Here, the muscles of the extensor compartment, the superficial muscles, there are two groups of muscle. One is superficial group and one is deep group of muscle. Everything is very much visible in the cadaver. But the superficial group of muscle, then takes origin mainly from the lateral condyle. Okay, but the posterior part of the lateral condyle is for the origin of the common superficial extensors. But they also takes origin from the deep fascia. So it is very much adherent with the deep fascia. We will show you in the cadaver, they are adherent, the muscle fibers are adherent. Carefully we dissect especially in the upper part, because they are adherent with the deep fascia. Just remember one thing, the common extensor, the common superficial extensors, not the deep, the superficial extensors take origin from the posterior part of the lateral epicondyle. Which epicondyle is very much prominent? Medial or lateral? See, medial. So lateral is not that prominent, but this is both medial epicondyle and lateral epicondyle, they are very important because the medial gives origin to the superficial flexures and the lateral gives origin to the superficial extensors. When we will remove the deep fascia carefully, we will find the superficial group of extensor muscles. I will show you in the slide also. But remember, there are 7 superficial extensor muscles. And there are 5 deep extensor muscles. From lateral to medial, we will get brachioradialis, which takes origin from upper 2/3 of the lateral epicondyle, supracondylar line. Lateral supracondylar line, which one is this? This is very much prominent on the lateral side, and similarly the medial supracondylar line, which is prominent in the medial side of the shaft of the lower part of the shaft of the humerus. So this is called as supracondylar line. So this upper 2/3 is very important for the origin of brachioradialis, from brachium to the lateral part of the lower end of the radius. So brachioradialis, the first muscle on the lateral side. The next muscle from lateral to medial, that is also an extensor of the carpal. The brachioradialis, actually it is in the mid-prone position, it causes flexion. Okay. Previously it was supposed to help in pronation and supination, but electromyographic study has shown us that there is no relation with supination and pronation of this muscle. So in mid-prone position, it helps in flexion of the elbow joint, though it is a part of the extensor muscle. Then next muscle on the medial side, extensor carpi radialis longus. Extensor means extensor of carpal bones, not only the carpal and also the metacarpals or the wrist. Okay. So extensor carpi radialis longus. This is taking origin from the lower 1/3 of the lateral supracondylar line, and it is inserted in the second metacarpal. Extensor carpi radialis longus. Then extensor carpi radialis brevis. This is taking origin from the lateral epicondyle, and it is inserted in the 3rd metacarpal, on the dorsal aspect of the 3rd metacarpal, and also it gives tweak to the, it gives a slip to the 2nd metacarpal. Extensor carpi radialis longus and brevis. Then the most important muscle, that is extensor digitorum, extension of the digits, which takes origin from the common extensor as a common extensor origin. So this is extensor digitorum, and divides into 4 sleeves. There are 4 sleeves of this muscle. This ends in 4 tendons. These 4 tendons are for the medial 4 fingers. That is extensor digitorum. So ultimately it is inserted into the middle and distal phalanx. So it helps in extensor of digit. So extensor digitorum. The next muscle which is meant for the little finger, extensor, that is extensor digiti minimi, which will join to the medial side of the extensor digitorum, which is going to the little finger. So it helps in extensor of the little finger. And the next is the extensor carpi ulnaris. As an extensor, it is very easy to remember. The common origin is the lateral epicondyle, and it is going down along the extensor aspect of the forearm over the medial part of the posterior surface of the ulna and passes in between this styloid process and the head of the ulna and ultimately attached to the little finger. Okay, in the little finger there is a styloid process. It is inserted over the little finger. So extensor carpi ulnaris. And the last superficial extensor we have already seen, that is the anconeus, taking origin from the lateral epicondyle and inserted over the ulna. Now about the deep extensor, we have seen when we were studying the bones, we have seen the abductor pollicis longus taking origin from the dorsal or posterior surface of both ulna, dorsal posterior surface of the radius and the ulna, that is abductor pollicis longus. And along with another muscle, it will move hand in hand, that is the extensor pollicis brevis. Then we will get extensor pollicis longus, and that means which help in extension of the thumb. And we have seen that anatomical snap box in between the extensor pollicis longus, extensor pollicis brevis and abductor pollicis longus. And extensor indicis, we know it's taking origin from the dorsal surface of the ulna and it is inserted over the index finger. And the last muscle, that is the fifth muscle, which is present over the radius, that is the supinator. So 5 muscles. How you can remember? In Bengali we say ami shate pache nei. 7 superficial extensors and 5 deep extensors. Then can we find anything else in the posterior compartment, in a deeper plane, in between superficial muscles and deep muscles? Yes. We know there is a membrane in between the radius and ulna. Interosseous membrane. One vessel goes in front, that is the anterior interosseous artery or vessels, and one artery passes behind, posterior interosseous vessels. Actually they are coming from the common interosseous artery, Again, that is a branch from the ulnar artery. So along or just over the surface of the interosseous membrane, we will find a posterior interosseous artery. And the posterior interosseous artery moves hand in hand with another nerve, which is present again just over the interosseous membrane on the posterior aspect. That is very suggestive name, that is posterior interosseous nerve. Over the posterior aspect of the interosseous membrane, if the artery is posterior interosseous artery, the nerve should be called as posterior interosseous nerve. All these muscles, actually this posterior interosseous nerve is nothing but a deep branch of the radial nerve. Radial nerve here divides into superficial and deep. There is supinator muscle. Within the supinator muscle, it divides into superficial and deep. And the deep branch enters into, just before entering into the supinator muscle, this radial nerve divides into superficial and deep branch. This deep branch passes through the supinator muscle and it appears in the posterior compartment of the forearm. Here we will see that posterior interosseous nerve, and all these muscles are supplied by this posterior interosseous nerve. This brachioradialis muscle, actually posterior interosseous nerve is coming from the radial nerve. So this brachioradialis muscle is getting its supply from the trunk of the radial nerve. The extensor carpi radialis longus, it is coming from the radial nerve. Okay, these two. Others are supplied by the posterior interosseous nerve. And this posterior interosseous nerve in the lower part forms a pseudoganglia. There is swelling over the nerve. That is called pseudoganglia. Pseudoganglia means not real, pseudo, mitha. Actually, it is a covering of the connective tissue over the nerve. This pseudoganglia is present here in the posterior interosseous nerve. Pseudoganglia is present in the posterior division of the axillary nerve. Pseudoganglia is present in the deep peroneal nerve of the lower limb. Okay, the lateral branch of the deep peroneal nerve. And also the pseudoganglia is present in the median nerve. Okay. So first we will see the figures or diagrams. Then we will correlate all this. So these are all the posterior compartment muscles. We can find most laterally, this is the brachioradialis. Then we are getting the extensor carpi radialis longus. You can see the extensor carpi radialis longus. Then more medially, this is the extensor carpi radialis brevis. Here. Then this extensor digitorum, you can see it is taking origin from the common extensor platform, okay, on the lateral epicondyle. It divides into 1, 2, 3, 4. 4 tendons. And the peculiarity we can see, this tendon, when it is crossing the proximal phalanx, this is proximal, this is middle, and this is the distal. When this tendon is crossing the proximal phalanx, at the base of the proximal phalanx, it forms a thickened tendon which is called dorsal which becomes very thick. It is called dorsal digital expansion. Dorsal digital expansion. And you can find this dorsal digital expansion divides into 3 components. Like this. Dorsal digital expansion, you can see. And the lateral 2 parts again joins at the base of the distal phalanx, and it is attached to the distal phalanx, whereas the middle one is attached to the middle phalanx. So as a whole, when it will contract, so it will not only cause the extension of the distal phalanx, it will also cause extension of the middle phalanx. And there are some muscles which are attaching, that muscle tendons are attaching on the medial or lateral side of this tendon. So this is the extensor digitorum. The tendon is going to the little finger. On its medial aspect, we get another muscle, that is extensor digiti minimi, which is attached to the medial aspect of the tendon of the extensor digitorum, which is going to the little finger. And most medially, we get extensor carpi ulnaris. And in the above, we can find this triangular muscle, this is anconeus. So these are the superficial extensors. We can find, if we retract the superficial extensors, we can find these muscles. These are the deep extensor muscle. You can see this muscle and this muscle tendon moves hand in hand. You can see these 3 tendons are going towards the thumb. This one, and this one. This one is the abductor pollicis longus, and in between there is extensor pollicis brevis. They are moving hand in hand, and it is going towards the thumb. Then more medially we can get this muscle, that is the extensor pollicis longus, which is going to the distal phalanx. Abductor pollicis longus is going to the proximal phalanx, and whereas the extensor pollicis longus is going to the distal phalanx. And more medially we will get this muscle, this is the extensor indicis. Actually this extensor indicis is joining the fiber of the extensor digitorum on its medial side. And the 5th muscle, that is, which is actually present over the upper part of the radius, in between the anterior and posterior diverging lines, this is the supinator. Now this is the posterior radial nerve is dividing into superficial branch and this deep branch. And this deep branch is passing through this supinator muscle, and it is divided into so many branches which are supplying all the extensor muscles, both the superficial and deep extensor muscles. So this is posterior interosseous nerve. Posterior interosseous nerve is very important for your exam. It comes as a short note. Posterior interosseous nerve. Now this is the, we know, this is the interosseous membrane. From lateral side we are seeing one, this is a common interosseous artery. It forms the anterior interosseous artery and divides into anterior and posterior interosseous artery, and this is the posterior interosseous artery, and ultimately it forms a network which is called the dorsal carpal network over the posterior interosseous membrane. Now, this is the anatomical snub box formed by, on the lateral side, this is the abductor pollicis longus, extensor pollicis brevis, and this is the extensor pollicis longus. So this is the anatomical snub box. And this anatomical snub box comes as a short note. Very often it comes as a short note. So this is the anatomical snub box where we can get one artery, that is the radial artery, and this is the superficial branch of the radial nerve. And flow is formed by the lower part of the radius. This is scaphoid and the trapezium, and also the base of the proximal phalanx, a part of the base of the proximal phalanx. So this is the content. So contents are radial artery, radial nerve, and cephalic vein.